let us know a little bit about yourself and your journey that led you to forming Nolia.
Oh my goodness, absolutely. So I'm Alice. I'm a licensed clinical social worker at Nolia Health. I've been in the aging field for over 10 years. I specialize in palliative care, aging adults, caregiving, and I would say the founding story has to kind of include both of us.
Okay, that sounds good.
So, I was at the Alzheimer's Association here in Washington State 7 or 8 years ago, which is where I was supporting families living with Alzheimer's disease and related dementias. And that's actually where I met Dr. Sabai, who is down at Valley Medical Center, which is a community hospital down in Renton. Dr. Sabai pioneered this dementia clinic. Why don't you tell a story a little bit about how that sounded?
Sure. So yes, I'm Dr. Sabai. I am a neuropsychologist. I specialize in dementia and movement disorders. Like Alice, I've been working in this space for over a decade now, supporting families, patients with neurological conditions, and walking them through that journey. And I think our story begins, I left fellowship and came here to Seattle to take a job in the neurology department at Valley Medical Center, where I was a provider. And shortly after starting there, felt like neurology is a diagnostic practice. And oftentimes we are giving diagnoses that are not just life-altering for the person living with the condition, but really seem to have this ripple effect and it moves throughout the family and the support systems. And traditionally, appointments are geared so much towards the patient and their care and their needs, which is very important, but we're missing sort of a really big pillar in our healthcare system, which is the family caregiver.
Exactly.
And so I felt dissatisfied with what we were doing. I don't want to just be a diagnostician. I want to help people on this really complicated journey. And so I started a dementia program there that didn't exist there or really anywhere else, where realizing that we can't all do this alone. Even as a healthcare organization, we didn't have all the folks that we needed on a team to really support people on this journey. So I reached out to the Alzheimer's Association, recognizing that these community-based organizations and healthcare system, they're not talking. I need to bridge that gap. I need to get people the resources that they need. And I'm also not a social worker, and our social workers are like the glue of our communities. So that's, Alice came to work with me, and I think we just had similar visions and minds, and we just kept building the clinic more and more, and there was such a need for it.
This was within Valley Medical?
Yes, initially.
Okay. Got it.
And we got, we had a wait list for like a year, which then I come back and I'm like, this is a problem again, because access to care is needed, and this is clearly a needed service. I think there was a lot of benefits in proving out the model of care while we were working at Valley. We got to collect data for 8 years, both qualitative and quantitative, just to see what kind of help, does this support provide? Not only the person living with the condition, their families, but the healthcare system at large, which is suffering from these admissions, that people coming in using the emergency room as a safe space because they don't know where else to turn. So, we were able to reduce emergency room visits by 52% within the first year, which is a massive thing for
That's
healthcare
amazing.
systems.
The administrators there must have been happy.
Yeah.
Right.
And on the other side, patients were doing better, families were doing better, we were reducing caregiver burnout. So all the outcomes that we would hope for came out of that. And then we just wanted to make it more accessible. I love serving the community in South King County, but there's a lot of dementia deserts out there, and there's a lot of people that don't have access to this specialized care. So we decided to work in parallel with the existing healthcare system to come in and fill in the gaps and provide this extension of care for folks. And that's how Nolia Health was born.
Got started.
That's where it is.
Yeah.
Wow, that's really amazing.